Symptoms of mercury poisoning. The symptoms of mercury poisoning depends on duration, intensity, and route of exposure. For example, inhalation and skin absorption, the main targets are different. The mercury health effects also depends on chemical forms. We will know the organic mercury poisoning can make Minamata disease. The Minamata disease is real, but the symptoms are severe. The patient who has brain damage. It has a central nervous system toxicity. So you will find a patient with poor concentration, fatigue, ataxia, tremor, and constricted visual fields. Before we knew the Minamata disease patients at last will lose their hearing, visual, and their speech. Some are patients with coma, even death. Besides CNS toxicity, the organic mercury poisoning also can make a patient with BM suppression. The even more worse, for this kind of patients, they will have poor response to treatment. So you will find it's quite hard to do the treatment for a Minamata disease patient. For the inorganic mercury poisoning, the symptoms are quite different from organic mercury poisoning. You will find the patient with the three different toxicity. The first one is the gastrointestinal phase. So you will find the patient with the gingivitis, stomach problem, and you will find the patient with the bowel erosions. And some of them will have the blood systems problem. And you also can find the worst one with a severe collapse. Besides the GI problem, you will find the patient with a systemic toxicity. So they will have hypertension, lactic acidosis. That is because mercury inhibits the enzymes, the esophageal enzymes. So the patient will have the hypertension and the lactic acidosis. And also, you will find the patient with acute renal failure and potentially leads to the CRF in survivors. For the survivors, we should be careful the CRF. That is inorganic mercury poisoning with three different toxicity. And for another form called elemental mercury, the elemental mercury goes inside the body. The main route is inhalation. Also, the patient absorbs the elementary mercury through skin. For the inhaled elemental mercury, there's two different kinds. The first one is acute. For the acute elementary mercury, the concentration should be high. So you will find the patient after acute exposure to the elemental mercury, they will have irritant respiratory effects. The patient with the cough for quite a long time, and then they find doctors. If the patient will not have good treatment, they will have ARDS. Besides irritant respiratory effects, the patient will also have metal field fever. This fever, just like flu-like symptoms. So sometimes if the patients go into the hospital with flu symptoms, doctors may mistake with flu with elemental mercury poisoning. So we should be very careful for this kind of symptoms. You can also find acute exposure to the elementary mercury, the patient with CNS features. The patient will have confusion, emotion lability, and psychological problem. And you will also find they have CNS depression. Some of them will go to coma. And last, for the acute exposure, the patient will have renal effects. This is kind of rare, but we should be very careful with ARF symptoms. So, for the inhaled elemental mercury, we have a word to explain the symptoms of the acute exposure to the elementary mercury patient. The word is urethane. How to explain the urethane? The urethane can be tremor first. This is E tremor first. And you will find the patient with a peripheral neuropathy and sweating. The very interesting thing is you will find the patient change their personality. There's a case about this personality changed person. One day, the wife told the doctor she has another husband. She said, before my husband was so gentle, but few years later, he easily gets cross and with bad temper. When the doctor asked, why you think so? And the wife said, maybe my husband has a mental problem. And tell the doctor to do some examination for her husband's brain. So we should be careful with the personality change the patient. The doctor suppose may have the brain problem. You also should think about the elementary mercury. This elementary mercury also can change person's personality. So this is quite special symptoms for the elementary mercury. You will also find the patient with a stomach problem and the gingivitis. For a chronic one, they will hurt their renal. So this is elementary mercury poisoning. Taken them together, for the mercury health effects, the symptoms of acute poisoning include cough, fever, nausea, vomiting, and feeling of tightness in the chest. They all belong to the respiratory system's problem. And this is the stomach's problem. This we call acute poisoning. And for the chronic poisoning, the central nervous systems and the kidneys are the key targets. So you will find elementary mercury poisoning, the patient with nervous systems problem. And for the inorganic forms, the patient with respiratory and GI problem. This is for acute exposure. And for the chronic exposure, the patient with the kidneys problem. And for the organic mercury, we all know this is Minamata disease. So you will find the patient with nervous system problem and for the baby, the fetus with developmental effects. So for the elemental mercury, not classified with respect to carcinogen. So this is central nervous systems and kidneys for mercury health effects. Besides this, you will find the patient with the observed effects. The most serious effects of chronic mercury exposure related to its impact on the nervous systems and the kidney. And list all for the symptoms of the mercury effects.